Oral contraceptives birth control pills are hormone-containing medications that are taken by mouth to prevent pregnancy. They prevent pregnancy by inhibiting ovulation and also by preventing sperm from penetrating through the cervix. Advantage of contraceptives, for example, not only prevent pregnancy, but they also reduce the risk of endometrial and ovarian cancer and protect against acute pelvic inflammatory disease and ectopic pregnancies. Disadvantages: contraceptives you may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Your periods may be irregular or stop altogether. You may get acne, or your acne might get worse. The most common side effects are spotting or bleeding between periods. This is more common with progestin-only pills, sore breasts, nausea, or headaches, but these usually go away after 2 or 3 months, and they don't happen to everyone who takes the pill. A transdermal patch is a patch that attaches to your skin and contains medication. The drug from the patch is absorbed into your body over a period of time. If you'd rather not have a pill or an injection, a patch may be a more comfortable option for taking some medications. Advantage: transdermal patch. Transdermal delivery offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug-drug interactions. Patches can be easily applied by the caregiver, and they provide a visual cue that the medication has been administered. Disadvantage: transdermal patch. Some of the disadvantages associated with transdermal drug delivery include potential skin sensitization or irritation, discomfort from adhesives, imperfect skin adhesion, cast, and selectivity for specific physicochemical drug properties. Side effect of the transdermal patch: rash, redness, eye pain, redness, or discomfort, blurred vision, seeing halos or colored images, agitation, seeing things or hearing voices that do not exist, hallucinating, confusion. Vaginal rings are polymeric drug delivery devices designed to provide controlled release of drugs for intravaginal administration over extended periods of time. The ring is inserted into the vagina and provides contraception protection. Vaginal rings come in one size that fits most women. Advantage and disadvantage of vaginal ring: unlike the pill, the ring still works if you have sickness, vomiting, or diarrhea. The ring may ease premenstrual symptoms, and bleeding will probably be lighter and less painful. Some women have temporary side effects, including more vaginal discharge, breast tenderness, and headaches. You may not feel comfortable removing it from your vagina. You can have few months. It may cause temporary side effect, such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. Subdermal contraceptive implants involve the delivery of a steroid progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. Advantages of progestin implants include long-term contraceptive action without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. Disadvantages: you may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Your periods may be irregular or stop altogether. You may get acne, or your acne might get worse. Side effect: headaches, breast pain, nausea, weight gain, ovarian cysts, pain or bruising on your arm where the implant was inserted. An infection where the implant was inserted. Hormone injection prevents pregnancy by injecting a synthetic version of the hormone progestogen called depot-medroxyprogesterone acetate, or DMPA. The injection is also called depot. Depot prevents the body from producing its own hormones and releasing eggs from the ovaries. Advantage and disadvantage of hormone injections: it can be useful for women who cannot use contraception that contains estrogen. It's not affected by other medicines. Side effects can include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your periods may become more irregular, heavier, shorter, lighter. Side effect of the hormone injections: side effects can include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your periods may become more irregular, heavier, shorter, lighter, or stop altogether. Intrauterine device. Intrauterine device, also known as intrauterine contraceptive device or coil, is a small, often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. IUDs are one form of long-acting reversible birth control. Advantage of the intrauterine device. It protects against pregnancy for 5 or 10 years, depending on the type. Once an IUD is fitted, it works straight away. Most people with a womb can use it. Disadvantage of the intrauterine device. There are certain disadvantages of the intrauterine devices. These areas are expelled without the knowledge of the wearer in about 10 to 15% of the women, and they run the risk of becoming pregnant. Side effect of the intrauterine device. Side effect: spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during your periods, pain when your IUD is put in, and cramping or backaches for a few days after. Chemical barriers. Chemical barriers also protect against infection by pathogens. They destroy pathogens on the outer body surface at body openings and on inner body linings. Sweat, mucus, tears, saliva, and breast milk all contain antimicrobial substances such as the enzyme lysozyme that kill pathogens. Advantage and disadvantage of the chemical barriers. These methods do not prevent pregnancy as well as IUDs or hormonal forms of birth control. Barrier methods prevent pregnancy only if you use them every time you have sex. You may have to interrupt sex to use some barrier methods of birth control. Side effect of the chemical barriers. Side effects of barrier methods of birth control can include an increased risk of developing urinary tract infections, UTIs if using a diaphragm and spermicide. Leaving a diaphragm or cervical cap in for longer than 24 hours increases your risk for toxic shock syndrome. Diaphragm. The diaphragm, located below the lungs, is the major muscle of respiration. It is a large, dome-shaped muscle that contracts rhythmically and continually, and most of the time, involuntarily. Upon inhalation, the diaphragm contracts and flattens and the chest cavity enlarges. Advantages of a diaphragm or cap. You only need to use a diaphragm or cap when you want to have sex. You can put it in at a convenient time before having sex. Use extra spermicide if you have it in for more than 3 hours. There are usually no serious associated health risks or side effects. Disadvantage of diaphragm. It's not as effective as other types of contraception, and it depends on you remembering to use it and using it correctly. It does not provide reliable protection against STIs. It can take time to learn how to use it. Putting it in can interrupt sex. Side effect of diaphragm. From the spermicide, irritation of the vagina and surrounding skin or an allergic reaction, strong odors or vaginal discharge if the diaphragm is left in too long. An allergic reaction to the material in the diaphragm. This is rare. A high risk for urinary tract infections, UTIs. Cervical cap. A cervical cap is a little cup made from soft silicone and shaped like a sailor's hat. You put it deep inside your vagina to cover your cervix. Advantage of the cervical cap. Advantages. Unlike the diaphragm, the cervical cap protects against pregnancy for 2 days, 48 hours, and for multiple acts of intercourse within that time frame. When placed appropriately, the cervical cap is often not felt by either partner during sexual intercourse. Disadvantage of the cervical cap. Disadvantages. The cervical cap is more difficult for women to learn to insert and remove than the diaphragm. If worn for more than 2 days, 48 hours, you run the risk of toxic shock syndrome or unpleasant vaginal odor and discharge. Mild allergic reactions to the silicons. Side effect of the cervical cap. From the spermicide, irritation of the vagina and surrounding skin or an allergic reaction. Strong odors or vaginal discharge if the cap is left in too long. An allergic reaction to the material in the cap. This is rare. Changes in the cervix because of irritation. Male condoms. The male condom is a sheath placed over the erect penis before penetration, preventing pregnancy by blocking the passage of sperm. It is a barrier method of contraception. A condom can be used only once. Advantage of the male condoms. Advantages of using condoms. When used correctly and consistently, they are a reliable method of preventing pregnancy and protecting both partners from STIs, including chlamydia, gonorrhea, and HIV. Disadvantage of the male condoms. Might disrupt spontaneity during sex, can reduce sensitivity. Some men cannot maintain an erection when using a condom. Some men and women can develop an allergy or sensitivity to latex in this case. Polyurethane condoms may be used. Side effect of the male condoms have no side effects. Most people can use condoms with no problem. There are no side effects. Rarely. Latex. Rubber condoms can cause irritation for people with latex allergies or sensitivities. Female condoms. Female condoms are a barrier method of contraception worn inside the vagina. They prevent pregnancy by stopping sperm meeting. An egg. A female condom can be put into the vagina before sex, but make sure the penis does not come into contact with the vagina before the condom has been put in. Advantage of the female condoms. Female condoms help to protect both partners from STIs, including HIV. When used correctly, they're a reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. Disadvantage of the female condoms. They can slip out of place during sex. They can irritate your or your partner's skin. They might make the sensation of sex less intense. They're slightly less effective at preventing pregnancy and STDs than male condoms. Side effect of the female condoms. When used correctly, they're a reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. Surgical methods. Open surgery. An open surgery means the cutting of skin and tissues so that the surgeon has a full view of the structures or organs involved. Advantage of the surgical methods. Prevention of or improvements to medical conditions caused by a patient's obesity. Surge in energy. Increased life expectancy. Increased self-esteem. Disadvantage of the surgical methods. Disadvantages of surgical sterilization include the following: it requires surgery, usually under a general anesthetic. There is a risk, albeit low, of surgical complications such as internal bleeding, infection or damage to other organs. Side effects of the surgical methods. Pain during and right after surgery. A surgeon typically works with the anesthesiologist to manage pain using medication to block the awareness of pain, called anesthesia. Abstinence. This means avoiding all types of intimate genital contact. Someone practicing complete abstinence does not have any type of intimate sexual contact, including oral sex. Advantage: freedom from worry. You'll have no concerns about unintended pregnancy and or sexually transmitted infections. Disadvantage: experience shows that even people committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Side effect: anxiety and stress. Memory, relationship health, immune system, vaginal walls and lubrication, prostate cancer. Calendar methods. The calendar method helps you predict your fertile days by tracking the length of your menstrual cycles over several months to create a fertility calendar. Advantage of calendar methods. Thus, by calculating the midpoint of the cycle, women can also work out when they are potentially fertile and when they are definitely infertile. Sex can then be avoided or an alternative method of contraception used on the fertile days of the cycle. Disadvantage of calendar methods. The biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle, and even then, it can be hard to be 100% sure what days you're fertile. Side effect of calendar methods. There are no physical side effects and you can use it to plan when you get pregnant. You have to keep a daily record of your fertility signals, such as your temperature and the fluids coming from your cervix. It takes 3 to 6 menstrual monthly cycles to learn the method. Basal body temperature. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in basal body temperature. You'll be most fertile during the 2 to 3 days before your temperature rises. By tracking your basal body temperature each day. Advantage of basal body temperature. Basal body temperature can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Disadvantage of basal body temperature. The basal body temperature method may not accurately predict ovulation in all women, including those with irregular menstrual cycles. It offers no Protection from sexually transmitted diseases. Side effect of basal body temperature. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Some women may choose to use the basal body temperature method for religious reasons. The basal body temperature method can also be used to detect pregnancy. Cervical mucus methods. The cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Advantage of cervical mucus methods. The cervical mucus method is one of the most effective natural birth control methods. It helps a female keep track of her fertility days each month. This method is all about using natural methods of birth controls. Disadvantage of cervical mucus methods. The cervical mucus method does not protect against sexually transmitted diseases. Also, several outside factors can change the look and feel of cervical mucus. These changes may make it difficult to evaluate the mucus to predict ovulation and prevent pregnancy. Side effect of cervical mucus methods. The cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Symptothermal method. Symptothermal method, a fertility awareness method, used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. Advantage of the symptothermal methods. The symptothermal method is easy to learn and an effective FABM for attempting to achieve or avoid pregnancy. There are no devices or drugs to use that harm the body or a couple's fertility. Disadvantage of symptothermal method. Disadvantages of the method are that intercourse must be restricted to only 7-13 days of the cycle. Women must take their temperature daily. The method cannot be used during fever episodes, and the method is inappropriate for use during lactation or near menopause. Side effect of symptothermal method. Both these methods are associated with side effects, particularly in combination with other medications and tobacco and health complications including mood changes, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain and uncommonly, blood clots. Ovulation detection. There are several ways to detect ovulation, including urine test kits to measure LH levels, transvaginal ultrasound, endometrial biopsy, blood tests to measure hormone levels, and the basal body temperature BBT chart. Advantage of ovulation detection. By detecting a surge in LH, it helps predict when you will ovulate. Knowing this information helps you and your partner time sex for pregnancy. You can buy ovulation tests at most drugstores. Disadvantage of ovulation detection. Disadvantages include limited detection. Ovulation tests detect LH levels, but they don't give you an exact date of ovulation. Eggs may not emerge even after an LH surge. Side effects of ovulation detection. Ovulation pain can feel like a sharp or dull cramp on the side of your abdomen where the ovary is releasing the egg. This ovulation side effect can last anywhere between a few minutes and a few hours. Coitus interrupts. Coitus interruptus, also known as withdrawal, is a traditional family planning method. Advantage of coitus interrupts. Some benefits of coitus interruptus are that the method, if used correctly, does not affect breastfeeding and is always available for primary use or use as a backup method. In addition, coitus interruptus involves no economic cost or use of chemicals and has no directly associated health risks. Disadvantage of coitus interrupts. Disadvantages. Men discharge a small amount of semen before ejaculation. Men withdraw their penis late and inseminate the female. And side effects include loss of sexual. Side effects of coitus interrupts. Side effect using the withdrawal method to prevent pregnancy doesn't pose any direct risks, but it doesn't offer protection from sexually transmitted infections. Some couples also feel that the withdrawal method disrupts sexual pleasure.